There is a necessary research to investigate the perception of women at Ikobi town on criminal abortion and its effects. The research was conducted using women from the ages of 13 and above in Ikobi in the Fidakwabe district of Asante region in Ghana. The research was conducted to ascertain the perception of women on criminal abortion and its effect. In all, 30 women were selected using a simple random method for the study. Questions were used to collect views from the women in Kobe on the perception, reasons, methods, and effects of criminal abortion. The quantitative and descriptive approach was used for this study. Now, it was identified in the research that most women have knowledge about criminal abortion. Most or all the respondents knew that criminal abortion is an abortion performed outside recognized medical system, while some raised concerns that it's their own cup of tea, hence it should be legalized. Criminal abortion is worldwide a problem, hence a need to recognize it. A report given at the emergency unit of Adu-Nkansah Hospital in the Fidakwabe district in Asante region in Ghana indicates that many young women report with the issue of criminal abortion that necessitates the intervention of medical practitioners to prevent major complications. This has compelled me to investigate into the perception of women at Impobi community on the criminal abortion and its effect. According to Utah, in 2002, high morbidity and mortality rate from unsafe abortion suggests that unskilled people in unhygienic environments may be performing these procedures, implying that more effective strategies have to be developed by family planning providers to reduce the use of unsafe contraceptive practices, including termination of pregnancies in Ghana and other developing countries. According to VK and Fon, in many developing countries, safe abortion services are not available to the extent permitted by law. The predominant reasons for the abortion were too many children, indicative of about 34 to 34.4%, contraceptive failure 20.3%, premarital affairs 38.6%, medical reasons 5.4%, and extramarital affairs making 1.3%. Now, criminal abortion, as earlier stated, is an abortion performed outside a recognized medical facility or medical system. Abortion is defined as termination of pregnancy by any means before the fetus is viable. Viability is now considered to be reached at 23 to 24 weeks of gestation. That's the extent of pregnancy it goes to before a child is delivered. Second trimester or mid-trimester is a period ranging from 13 to 28 weeks of gestation, which again is subdivided into an early period between 30 and 20 weeks and later period between 20 and 28 weeks. In this review, we have limited late abortions up to 24th week of gestation. Termination of pregnancy by induced abortion is practiced worldwide. Induced abortion, either elective or therapeutic termination of viable pregnancy, is one of the most ancient procedures. Of the 210 million pregnancies that occur each year, more than 46 million end in induced abortion, according to a report by Goodmatch in 1999. Majority, 90% of the pregnancies take place in the first trimester. Worldwide, mid-trimester abortion constitutes 10 to 15% of all induced abortions, but is responsible for 2/3 of all major complications, according to World Health Organization in 1999. Although the majority of abortions are performed in the first trimester, there is a still gradual increase in the second trimester abortion because of the wide-scale introduction of prenatal screening programs detecting women with those pregnancies complicated by various fetal abnormalities such as cardiovascular and skeletal malformations. Now, unplanned pregnancies among young unmarried women are increasing globally, and it's very common among adolescents. Reasons for having an abortion include the desire to remain in school, financial concerns, and fear of social reprisal because of wedlock pregnancy, according to the report from Olakaroma 2000. adolescents face unique barriers to obtaining a safe abortion. Adolescents face unique barriers to okay. Adolescents face unique barriers to obtaining a safe abortion. When they become pregnant, they are slower to recognize and accept the pregnancy. They are less likely than the older, more experienced women to know where to seek advice and help. They may use ineffective methods to attempt to induce the abortion, and they may be unable to find a physician's fee. All of these factors may cause delays, and the later adolescent seeks an abortion, the more likely she is to suffer complications that may lead to hospitalization. Two hospitals-based studies found that of the women who say they had had an induced abortion, or whose symptoms indicated that they had had an induced abortion, they form about 70% most of adolescents, according to a report by Utah in 2002. Induced abortion seems to be fairly common among married women of high parity, advanced age, and low educational status. Now let's look at the method. A simple technique was used in the presentation of the population. 30 women were selected from the Mpobi town for the research. A simple random technique was used to select the area from the other localities in Mpobi township. By this method, each area has an equal chance of being selected. After selecting the area, an accidental method was used to select 30 women from the various homes. With this method, a data was taken from the women who were available and meet the research criteria. The questions were self-designed. It was constructed to find out the perception of the women on criminal abortion and its effects. Questionnaires were developed to obtain data from the research, which were in line with the research questions and objectives. The open-ended questions that will make the respondents freely their views. The closed-ended questions are those questions that will give the respondent an option to select an answer from the list of the items given without giving reasons. Most of these procedures were done so that the people could express themselves. The purpose of the research was explained to the respondents, and confidentiality was ensured. Their culture, values, traditions, and ideas were rarely expected. Now, this describes the characteristics discussions with the respondents. It includes their age, the number of children, and the method of which they commit a criminal abortion. Most respondents were between the age of 13 and 19 years, making about 40% in total, followed by 20 to 30 years, making about 27%. Then from 31 to 40 years, making about 20%. Finally, the least ages were about 40 years, making about 13%. The most respondents without children were about 40% of the total. Those having one child were about 10%. Then those having two children were about 17%. Those with three children were about 26%. Finally, those who were above 3 and more children were about 7%. And the number of children with which they had in the 30 women selected for the research. Now, out of the 30 respondents, out of the 30 respondents, 76.67% said they use cytotec, which is the highest drug in use for committing the criminal abortion, followed by penoroya, about 70%, and others, 6.67%, because they didn't want to disclose it, being the least. Out of 30 the respondents, 50% said they use homemade concoctions, being the highest, followed by 33% said they consume high volumes of vitamin C, and the least being alcohol consumption, being 17%. Out of the 30 sample population on the reasons for the criminal abortion, 50% said too many children were accounted for the reason for the criminal abortion. 83% said contraceptive failure, and 10% said population was 7%. This and others, they said this. Out of the 30 sample women on the effects of criminal abortion on maternal mortality, 87% said it can lead to maternal mortality, and 30% argued that it cannot. Some of the respondents gave some method as consumption of homemade concoction, high vitamin C intake, and alcohol. This confirmed what was reported by Coca and Gulati in 2008, that women in a developed area of India successfully perform abortion through the following methods: that's consumption of homemade concoction, high vitamin C intake, and alcohol. The bar chart indicates this. Now, the perception on the incidence of criminal abortion was also conducted among these same 30 respondents. 83% said it was high among adolescents, and 17.1% said it was high among married people, and the rest just didn't want to answer. The 83% agreed with and explained why the studies conducted in 2 hospitals found out that the women who said they had had criminal abortion, or whose symptoms indicated they had had criminal abortion, indicated about 70% were adolescent, and the reasons given were due to they wanted to remain in school, being the highest population, about 50%, followed by the fear of social reprisal, being 33%, and the least being financial concerns. The study went further to inquire from the respondents' perception in countries where criminal abortion activities were prevalent. Out of the 30 respondents, 33 said developing countries have been highest countries, followed by 27%, that is the countries where abortion is illegal than developed countries. Yes, please.
You're having another 2 minutes. You have to conclude now.
Okay. Now, in conclusion, what's the way forward? Now, the government should develop solid policies to restrict criminal abortion, expand and provide well-equipped laboratories in most remote clinics and hospitals in communities for easy access to be checked for which family planning method is suitable for each person. The affluent, private, thriving business and NGOs should come corporately to aid make family screening and medications free, or at least cost a penny, to aid prevent criminal abortion. There's a need for proper education about the harmfulness of criminal abortion and the after effects of abortion. Proper education, awareness, training session, guidance should also be given to people who are involved in abortion about the after effects of abortion. Family planning methods should be tangible to the adolescent by the immediate parents, guardian, or any better person in the community. The adolescent should be raised well. Standard to bring in consciousness starts from the heart through the sense requisite knowledge, self-help, and ability to challenge the perceived thought with the appropriate approach. There should be more education on family planning methods, such as the use of condoms. Condoms comes in sizes, and which condom you take determine on the sexual gratification you'll be able to get. Drawing attention to the unmet demand of the family planning methods among all groups is essential in preventing unwanted pregnancies. Now, as a nurse, the findings have major implications for the nursing service, education, and administration. The finding that most women perform criminal abortion due to contraceptive failure calls for nursing attention. In the same regard, the finding that most adolescents are engaged in criminal abortion calls for attention for nurses to go to senior high schools, tertiary, and even the community to give education on criminal abortion and its effect on the individual and the society as a whole. Illegal abortion cases should be restricted by paying attention to the lifestyle of our growing government, persons and personnel, and the mature should each play their role in this regard. Thank you so much for the opportunity.